Great. Thank you for the introduction, Dr. Jacobson. Thank you, SAGES, for the opportunity to present our research. I have no disclosures. So inguinal hernia repair is the bread and butter of general surgery. We do tons of these procedures annually, both in the United States and worldwide. There's a couple different approaches on how to do it. As we know, we can do open, robotic, laparoscopic, and there are several studies in the literature looking at which one of these approaches is the best. And the answer is a little unclear. I think there will be a talk later today about it. But there are very few studies looking at all three approaches in a head-to-head fashion. And so our study serves to fill this void and analyze the outcomes of open, laparoscopic, and robotic repairs. So we did a retrospective study between the years of 2016 and 2019 at a single institution. We looked at patients who underwent elective, unilateral, non-recurrent hernia repairs by one of 8 surgeons at a single institution. Outcomes of interest included operative time, baseline characteristics of the patient, as well as complications and recurrence. Looking at the baseline characteristics here, you can see that patients who underwent open repair tended to be significantly older than patients who underwent more of a minimally invasive approach, and they tended to have more comorbidities. When you look at outcomes, there were no significant differences in recurrence, hematoma formation, inguinodenia, which we characterized as groin pain over 3 months from surgery, and surgical site infection. There was a significant difference in seroma formation amongst the 3 arms. However, when you broke it down and performed a sub-analysis, this difference was no longer significant. This figure here outlines the operative time for repair. I want to highlight that robotic repair is in the green. And as you can see, between the years 2017 and 2018, there's a significant decrease in operative time. This decrease in operative time is also seen with laparoscopic repair, TAP in blue and TEP in red. However, the difference is not as pronounced. So in conclusion, what does all of this mean? There doesn't seem to be any significant difference in outcomes amongst the 3 approaches. The only significant difference is that laparoscopic repair is much quicker than the other 2 approaches. So what can we do with this? All surgeons should know that because the outcomes are so similar, they should perform the repair that they are most comfortable with and most experienced with. And while laparoscopic repairs are significantly quicker now, robotic repairs tend to be getting quicker as the years go on, and their operative time may come to resemble that of laparoscopic repair. So further studies can look at whether robotic repair continues to decrease in time and whether it approaches operative time of laparoscopic repair. Thank you.